Hello friends, my name is Ankit. I make educational videos on US healthcare trends. I also write blogs on US healthcare. I will leave the link below in the description for your reference. If you are new to my channel, welcome. Please like and subscribe to my channel so that you get updates on the latest content. In the previous video, we talked about what exactly is FHIR. In this video, we will talk about history of FHIR evolution. The initial draft of FHIR, then known as Resource for Healthcare (RFH), was published on Graham Greaves' blog in August of 2011. The standard was adopted by Health Level 7 International (HL7) as a work item in September 2011. In February 2014, HL7 published FHIR Release 1 as a draft standard for trial use (DSTU). FHIR Release 2 was published in October 2015 and FHIR Release 3 in March of 2017 as the standard for trial use STU release. FHIR Release 4, the first normative version, was published on October 30, 2019. We have come of age since the launch of FHIR Release 4. The FHIR standards have been used extensively across the healthcare industry, and right now HL7 is focusing on FHIR Release 5. What exactly is FHIR architecture? FHIR is organized by resources, for example, patient, observation, etc. Such resources can be specified further by defining FHIR profiles, for example, binding to a specific terminology. A collection of profiles can be published as an implementation guide, such as US code data for interoperability. Because FHIR is implemented on top of HTTPS protocol, FHIR resources can be retrieved and passed by analytics platforms for real-time data gathering. FHIR resources can be streamed to a data store where they can be correlated with other informatics data. Potential use cases include epidemic tracking, prescription drug fraud, adverse drug interaction warning, and the reduction of emergency room wait times, EHR payer integration, patient cost transparency, electronic prior authorization, and digital insurance card. These are some of the examples, but there are 40 plus work groups which are currently working on different facets of life to see how these standards can improve the health outcome. When we talk about FHIR architecture, this image is a depiction of a set of interrelated FHIR resources. Each resource consists of data elements that describes the relationship. FHIR introduction in United States. In 2014, the US Health IT Policy and Health IT Standard Committee endorsed recommendations for more public open APIs. In December of 2014, a broad cross-section of US stakeholders committed to the Argonaut project, which was to provide accelerated funding and political will to publish FHIR implementation guides and profiles for query, response, interoperability, and the document retrieval by May of 2015. The initial goal was to specify two FHIR profiles that are relevant to the meaningful use requirement, along with an implementation guide for using OAuth 2.0 for authentication. A collaboration agreement with Healthcare Service Platform Consortium, now called Logica, was announced in 2017. Experiences with developing medical applications using FHIR to link to existing electronic health record systems clarified some of the benefits and challenges of the approach and with getting clinicians to use them. In 2020, the US Center for Medicare and Medicaid Services, also known as CMS, issued their Interoperability and Patient Access Final Rule based on the 21st Century Cures Act. The rules require the use of FHIR by a variety of CMS regulated payers, including Medicare Advantage organization, state Medicaid programs, and qualified health plans in the federally facilitated marketplace by 2021. Specifically, the rule requires FHIR APIs for patient access, provider directory, and peer-to-peer exchange. The proposed rule from CMS, such as patient burden and prior authorization proposed rules, further specify FHIR adoption for the peer-to-peer exchange. The CMS rules and the Office of National Coordinator for Health (ONC) Cures Act Final Rule work in concert to drive FHIR adoption within their respective regulatory authorities. FHIR has been extensively used as an interoperability standard across the globe. HL7 International is currently leading 50 plus tracks to document FHIR implementation guides, and some of these guides are actively implemented across the industry. FHIR is the future. In the future videos, we'll be talking about the additional standards and implementation guides and try to spread awareness. Until then, see you next time. Have a good day.